Your child's first set of teeth are important for chewing, speaking, and looking good. They also contribute in very important ways to the proper development of your child's healthy adult teeth. Tooth decay is a common childhood disease. It can happen soon after a baby's first teeth appear, caused by a bacterial infection. Left untreated, advanced tooth decay can cause pain and discomfort, problems with eating and growing, problems with sleeping, problems with behavior, failure to speak properly, and failure to learn properly. Badly decayed teeth can lead to hospital surgery that involves doctors, nurses, special medical equipment, and your child's recovery time. Worst of all, the infection that causes tooth decay in baby teeth can be passed on to the adult teeth as they form below the gums, resulting in a lifetime of dental problems. How can you prevent these things from happening to your child? Just watch this video. You'll learn what to do. In the next few minutes, you'll learn how the infection that causes tooth decay is spread, how to reduce risk of infection, how to clean your child's teeth, and how to prevent tooth decay with good things to eat, good things to drink, and regular professional dental care. You will see that tooth decay is preventable. It's prevented by good choices that you can make for your child.
Tooth decay is a disease we see in far too many really young children, and one of the primary causes is actually a bacterial infection.
Tooth decay is caused by infection from a type of bacteria we all have in our mouths. There is less decay when there is only a small amount of this bacteria. With a proper diet and good oral care, the amount of bacteria can be kept low. Without proper diet and oral care, there will be high numbers of bacteria leading to more decay. As soon as baby teeth appear, they're exposed to the bacteria. It is passed from caregivers through their saliva by sharing utensils with baby, or cleaning off pacifiers or bottle nipples in an adult's mouth. If parents or caregivers have a history of tooth decay, it's more likely their baby will suffer from tooth decay. Make sure your teeth are in good shape and always sterilize pacifiers and nipples.
Once that bacteria are actually in the child's mouth, if we want to reduce the chances of tooth decay developing, what the parent can do is brush the child's teeth and pay attention to the kinds of foods that they eat and drink. The acids that are produced by bacteria can literally eat through the enamel of the teeth, and that's what a cavity is. The constant sipping from a bottle or a sippy cup means that there's a constant provision of energy for the bacteria, and they're consistently producing acids, so that frequent intake of foods and liquids is a really serious problem.
What and when your child eats and drinks has a lot to do with how much tooth decay your child can get. Once teeth come in, bacteria in the mouth mix with sugars and starches found in most foods in your child's diet, and an acid is formed. The more often your child eats or drinks, the more often the acid is made. That's why babies who develop a habit of getting a bottle or sippy cup for comfort, snacking, or to get to sleep are more likely to get tooth decay. As soon as the baby teeth appear, begin brushing twice a day with a fluoride toothpaste. Begin regular visits to the dentist within 6 months of the first teeth appearing. This, with good diet choices, will make it less likely for your baby to get tooth decay. Milk, infant formulas, and breast milk contain sugars. In fact, all liquids except water contain sugars that may be harmful to your baby's teeth. So it is best to hold your baby for bottle feeding rather than putting them to bed with a propped-up bottle. To ease the habit of using bottles or sippy cups, teach your baby to drink from a cup as soon as they can sit up by themselves. Learning how to drink from a cup takes time, can be messy, but just like walking and talking, good things take time to learn. By 12 to 18 months, most toddlers can drink from a cup and no longer need to use bottles or sippy cups. Sweetened liquids like soda pop or fruit punch are very damaging to teeth. Even unsweetened fruit juice like apple juice can cause decay. Do not put these drinks in bottles or allow a child to sip on them throughout the day. Give all liquids other than water as part of a sit-down snack or meal. Many solid foods, infant cereal, crackers, teething biscuits, and rice mix with bacteria to make acid. Foods like raisins, dried fruit, candies, cereals, or chips can stick in the back teeth. If teeth aren't cleaned off right away, the bad acid continues its action long after eating has stopped.
For a child that likes to have sticky foods, obviously the ideal thing would be to try to avoid them, but if they do, if a parent can actually make sure that the teeth are brushed afterwards. There are a lot of good snacks for kids, cheese, lean meats, raw vegetables, because they don't tend to stick in the teeth and they don't metabolize to produce acids, or they're not broken down into acids.
It's not just what your child eats that matters. It's also how often your child eats and how long bits of food stay in the mouth. The more often sugars and starches are eaten, especially between meals, the greater the chance for acids to damage the teeth. It's never too soon to start mouth care. When you begin brushing at an early age, you give your children the benefit of good oral habits for healthy adult teeth. Before the first baby teeth appear, daily mouth care begins by wiping gums with a clean, damp cloth after eating or feeding. As soon as the first teeth appear, start brushing them twice a day with a soft bristled toothbrush designed for babies. Use a fluoride toothpaste as a great way to reduce babies' risk of tooth decay, but use only a smear of fluoride toothpaste. This small amount is safe to swallow. Swallowing too much fluoride can cause white spotting on your child's adult teeth that are forming below the gums. And since some children like the taste of toothpaste, it's best to store it out of reach. When considering what toothpaste to buy, read the label. Be sure it's for children, because some adult toothpastes are not for children. Look for a name brand that is recommended by the Canadian Dental Association. When brushing your child's teeth, you can try lying your baby on a flat surface like a change table or a bed. Toothbrushing doesn't always need to be done in a bathroom. For older babies and toddlers, try sitting on the floor with your legs in a V and the child between your legs. The head should be closest to you, or you may wish to sit behind the child with the child's head in your lap. If your child's gums bleed when you brush them, your first reaction may be to stop brushing. However, bleeding means the gums aren't healthy, and to make gums better, continue to brush the teeth twice each day and the bleeding should stop. Many babies and toddlers resist brushing until they get used to it. If another adult is around, work together to get the job done using a knee-to-knee position, or try other ways of holding your child. The child may be unhappy at first, but they'll get used to brushing. Some children want to brush their own teeth. Let them. But remember, they're too young to do a good job. Parents need to continue to brush at this age, since children aren't usually able to do a proper brushing until they're well into school-age years. Along the way, when children won't cooperate, it's natural for parents to feel frustrated or to feel like giving up. But tooth decay is a nasty oral infection with painful and harmful results that may lead to dental surgery.
Brushing a young child's teeth is really a challenge, just like a lot of the other kinds of things that parents do for their children. So they need to persevere, and they need to think of some other options. If a child is upset, brush the teeth at another time of day. Sometimes it's a lot easier if there's two people involved, and then you can kind of make it into a game. Try to get some help from your local dental public health office or dentist on some ideas on positioning. The term lift the lip is something that's used quite frequently. What we'd like a parent to do is to lift the top lip and look at the front of the top front teeth, and also look at the back of them as well. And you can't do that really well without lifting the lip.
In its early stages, tooth decay looks like white chalky areas, on either the inside or outside flat surfaces of the tooth. More advanced tooth decay is dark yellow, brownish, or black. It may look like part of the tooth is breaking off. In serious cases, teeth will be dark brown or black with part or full loss of tooth crowns, leaving only the root at the gum line and the nerves exposed. Regular visits to the dentist will help find and treat tooth decay problems as early as possible. The dentist should see your baby within 6 months of the first tooth appearing and no later than 12 months of age. A checkup by a dentist takes only a few minutes. This first dental visit is important as it helps your child get used to dental visits and regular oral care. While checking for decay, the dentist will check to see if the teeth are appearing properly and help you with ways to reduce your child's risk of infection. An easy way for the dentist to examine your child's mouth is the knee-to-knee examination position. To begin, you'll hold your child face to face, then sit with your knees facing the dentist. Next, you position your child's legs on each side of your waist and lay their head on the dentist's lap while holding their hands. This position can also be used for brushing when there are 2 adults. With dental checkups starting at an early age, children learn that visiting the dentist is helpful and can even be fun. It's all about preventing tooth decay. If your child is at risk for tooth decay, a fluoride varnish can help. Fluoride varnish strengthens the teeth, making the outer layer of enamel harder and more resistant to decay. A fluoride varnish is ideal for young children. The varnish sticks to the teeth, so chances of swallowing fluoride are greatly reduced. The procedure is easy. It takes just a minute and does not need any special dental equipment. The child's teeth are dried with gauze, and the varnish is painted on using a brush. Unlike other fluoride treatments, the child can eat and drink afterwards. Your child's baby teeth are important for chewing, speaking, and feeling good. They also help make spaces in the jaw for adult teeth to grow into, so it's very important to help keep decay away. Remember, baby's oral health begins with your oral health. As soon as baby's first teeth appear, brush them twice a day with a fluoride toothpaste. Hold baby for bottle feeding. Don't let them roam or go to bed with a bottle. If your toddler must have a bottle at bedtime, put water in the bottle, not milk or juice. Never give soda pop to a baby or toddler. Don't give them sweetened drinks in a bottle or sippy cup. Teach your child to drink from a cup as soon as they are able to sit up by themselves. Give food and drinks as part of a sit-down snack or meal. Avoid letting your child walk around with a bottle, a sippy cup, or food. Take baby to visit a dentist within 6 months of the first tooth appearing and no later than 12 months.
We all know as parents that there's certain things that we do for our children that they may not always be happy with. Not all children like sitting in a car seat for the first few months that we do that, but they get used to it. We do it because we know it's safe for them. And brushing a child's teeth can certainly have a similar kind of response. So it can be challenging. Don't give up. Persevere, and hopefully things will kind of quieten down after a while.